As the mother rejoices after delivering a healthy baby, so is the National Resistance Movement as it celebrates achievements in the last 34 years. The Director, Mulago National Referral Hospital, Dr. Byarugaba Baterana, provides an overview of the health sector in the country.
First of all, it started in 1913. 1913, at that time, it began as a center for treatment of sexually transmitted diseases, especially syphilis and gonorrhea, as well as trypanosomiasis, that is sleeping sickness, which was mainly predominant in the present-day Kalangala district, and malaria, as well as what people called witchcraft, because many people at that time in Uganda here, there was a lot of witchcraft.
Having started as a center in 1913, there was need for Mulago to train paramedicals by 1924 to assist the British and Indian health workers for quality health service delivery.
And at that time, you see the 6th floor, when you look at the 5th floor, 6A, 6B, 6C, had been designed to be the private wing for the elite, the whites, and the people who were in petitions, actually. You can recall that in 1969, the president of Uganda was admitted in there. That is a fact. You can recall that. So that was a place actually of the elite.
Lower Mulago was constructed and handed over by the British to the newly independent Uganda between 1957 to 63. Makerere Medical School, housed at Mulago Hospital, was regional hub and center of excellence for training medical personnel within Uganda and from Kenya, Tanzania, and Zimbabwe, among others.
These Indians were the professors in the university. They were senior consultants here in Mulago, and when they went, now we started actually a decline in the services. The cases that used to come from Nairobi looking for us in Mulago as gurus, actually in the medical profession, people are coming from Nairobi, from Tanzania, and actually we're really much ahead. We are talking of Nairobi Hospital or Muhimbili National Referral Hospital, but Mulago was extremely too ahead of everybody.
Between 1970 and 1980, the Ugandan public health sector was on its knees, except for Mulago Hospital, though the expulsion of Indians and white medical personnel partially affected the institution. By 1986, Mulago was poorly lit, lacked water, and for that resorted to constructing pit latrines. It was until President Yoweri Museveni intervened that the institution normalized.
That the only place actually that was functioning and limping was Mulago. So people were coming now to Mulago, those of flu around here. At that time, actually, in the 70s, in 60s and 70s, we had even a cath lab, a cardiac catheterization lab, which you would use actually to see the heart. Those were in the Department of Medicine, but all of those stopped actually functioning because Mulago was already leaking. The roofs were leaking. So this is what you see, the blue roofs, which we are seeing in Upper Mulago here, were because of that loan of the early 90s of African Development Bank. And that was when the government came into power, and because the hospital was leaking, that is exactly what happened.
14 regional referral hospitals in the country are being refurbished, staff houses being constructed, some wards overhauled, and equipment purchased. The Executive Director, Mulago Hospital, Dr. Byarugaba Baterana, says a number of specialized training in treatment of kidney, liver, heart, lung, and cornea transplants have been carried out. Trained medics are eagerly waiting to demonstrate their skills in the new Mulago Specialized Hospital.
I understand also people can transplant the uterus and so forth, and they do very well. So we have had really training in that, and we have experts, and these experts are all really waiting for the day we open Lower Mulago, and they are really like cats waiting for rats, and they will be able really to do the needful, and that is exactly the catalyst of the NRM government.
Mulago Hospital has 27 intensive care units for adults and 8 for children, a magnetic resonance imaging, MRI, mammography, 16 centralized theaters, 2 X-rays, all which require expertise. Mulago currently boasts of the first ever female and neonatal hospital with 453 beds and 10 theaters, 110 housing units for health personnel, the Uganda Heart Institute, the Uganda Cancer Institute, Kiruddu, Kawempe, Butabika, and the Pediatric Referral Hospital.
Kawempe, Kiruddu, and Naguru were constructed to decongest Mulago and pave way for Mulago to handle only super specialized cases. And that is what they are currently doing and enhancing their capacity to do it.
Byarugaba is, however, not happy with medical personnel with double loyalty. He says a number of doctors work in more than one place, eating into the time of patients in public hospitals.
If you are a medical doctor and you are a consultant in Mulago and you admitted another a very sick patient in, for example, in Akasero IHK, and there's also another very sick patient in Mulago, it is 8 a.m. East African Standard Time. Where do you first go?
There are issues of absenteeism, theft of drugs, and taking of bribes by some health workers for services that are supposed to be free.
There is also need to enhance salaries for health workers to enable doctors work in one place.
To the improving of this is that you improve the salary of as a worker and say you must keep here. If you don't want to keep here and want to work elsewhere, go. Because I think this was done for the judges and the magistrates. Once you're employed by government, you don't go into the private chamber.
That enhancement of the salaries of the medical personnel can also be done so that we can be able to attract back the human resources, the critical human resources that we need in the health sector.
In service delivery, a lot of preventable diseases, especially the immunizable diseases, were at 34%, prompting President Yoweri Museveni to relaunch the immunization program in 1987. There was high malaria burden, polio and TB. In 2000, more than 4.6 million children under the age of 5 died of 6 killer diseases. But there was a drastic reduction, down to 2 million in 2015.
So when we talk about 34 years of NRIM, I must say there has been great achievement in the health sector. And I will start with the statistics. First of all, our life expectancy increased from where it was at 45 years now to 63 years. When the life expectancy of a population increases, it means the health of the population is better.
There has also been a reduction in maternal mortality rate, with figures dropping from 505 at a time to 336 per 1,000 live births.
At that time, our infant mortality rate was at 150 per 1,000 live births. Today, our infant mortality rate has dropped down to about 43. The under 5 mortality rate was very high, over 90. Today, it is at less than 54.
There is progress in HIV/AIDS treatment, with the number of people on antiretroviral drugs. Over time, government has increased investment in funding ARVs to the tune of US $32 million yearly.
And if we are to extend, by the end of 2021, we should be able to reach epidemic control. Epidemic control means we have hit the 95 targets. Then we can work towards ending AIDS by 2030.
We've also observed that there is an increase in a type of strains that we refer to as recombinant strains, which means that the virus has a mixture of different strains that form a particular virus that goes on to infect an individual.
Efforts to combat HIV/AIDS prevalence has necessitated government to spearhead a number of campaigns, including condom use, male circumcision, and the ABC strategy. Uganda Virus Institute in Entebbe, that is mandated to research on viral diseases, including HIV, is one of the major health achievements in the health sector. Uganda Virus Institute is studying the genetic makeup of HIV strains that are prevalent in the country. Scientists recommend that special attention be given to high-risk groups, for instance, the fishing communities, commercial sex workers, and truck drivers.
Truth of the matter is it's important to intervene in those communities, but it's also important to extend those interventions to the neighboring general populations that are further inland, because infections are coming from there into the fishing community.
Non-communicable diseases are also among illnesses killing over 40% of Ugandans annually.
This ministry recognized the issue, the big challenge of non-communicable diseases, and raised the non-communicable diseases program into a department. It's now a fully-fledged department, but underfunded. I hope we shall get resources to fund and get more staff.
Ministry of Health has of late directed all ministries and government agencies to secure a special day for exercise to ensure good staff health. Uganda's health system has also improved by about 3 times what used to be before 1986.